Hi, everyone. It's DocTalk. Summertime, things are going well in many areas of the country in regard to weather and other things. Condolences to some of the people affected by violent weather, like those in Wisconsin this week. That hit kind of close to home because one of the primary providers of fire and EMS apparatus was in that tornado zone. Fortunately, no loss of life in that area. A topic important today for our EMS providers, and one of the ones we've received a number of questions about, and that is in regard to violence against public safety providers. And here I'm going to talk specifically about fire and EMS providers and violence against them and what can be done to protect our members from violence from patients or family members or sometimes random people in the field of emergency care. A couple of steps specifically that are being worked on and that need to continue to be worked on. Number one, let's talk about our providers. Many organizations now have training, specifically providers, on self-defense against violence, what to do verbal de-escalation and verbal restraint of people who are acting out for one reason or another related to behavioral or criminal or similar issues. So, what can be done to safely de-escalate and then for you to back away, and what defensive postures you can take, even physically, to be able to protect yourself. In all of these cases, this comes from you proactively anticipating somebody being violent and beginning to assume a defensive posture, which oftentimes has something to do with putting your hands in front of you, and then slowly backing away from whatever may be dangerous and leaving you with an exit path out for you and whoever else is with you. Number two, what are the things that can be done verbally not to further escalate and to de-escalate? And then a very important part of this is procedures that are used when there is a violence that is taking place. In the fire world, we're used to this. That's called a mayday, and we have specific procedures in place. EMS organizations are also coming up with what is essentially a Mayday procedure for them when they are being faced with a weapon, someone who clearly is dangerous to them, and it's an uncontrolled circumstance. Typically, there's a code for that. And then the procedures oftentimes follow that of Mayday procedures in terms of radio, in terms of limited communication, in terms of a clear delineation of what the problem is and how it can be resolved. That's the part and the actions by the public safety people. Number two, there are patient things that can be done. Number one, let's make sure that we understand a patient who has a medical reason to be dangerous, we have responsibility for. The most common one, very honestly, is the patient who has a blood sugar problem. And because of the blood sugar problem, they are acting in an abnormal way. You may have law enforcement and other people there. It's our opportunity to work with those people, but we have primary in being able to hold them down and resolve the issue, which in some of these cases is administering medication that will make that patient better. Um, there are people who are very passive, but when their blood sugar goes low, they get quite violent and verbal and other things, and we need to know safe ways to be able to manage the patient. Another common situation is the patient with a medical dementia and uncontrolled behavior based on that. Those people, we have a responsibility to be able to safely restrain them. We begin with a verbal restraint, then sometimes have to go to a physical restraint, and then sometimes use chemical restraints in a very safe manner and monitoring the patient. So there are things we can do related to the patient to safely diffuse or de-escalate the situation, be able to get them turned around so that we can be safely able to address medical issues and the issue. Number three, on the proactive side, designing our equipment, designing our work areas, and then in places where we're in homes or other things, what can we do to get dangerous items away from people so that they do not become weapons against us? In many places, they are fixing the medical area around the patient so that they cannot readily pick up things that can become weapons. In particular, things that could be used to stab at or slash EMS people. So the mechanics of setting areas up so that pieces of medical equipment don't become weapons against us. Number four, very importantly, is messaging to the communities. And when there is violence, that our public safety people, meaning fire and EMS, will back away and let law enforcement do their work. And if there are issues related to violence against EMS people and fire people, that will be prosecuted. And so there should be very clear message. We're here delivering health care to you. We're here delivering emergency service to you. You cannot be violent against us. We are here because of our 911 responsibilities to take care of you. There are obviously intentional acts that are very bad when people essentially set booby traps and send out false calls in order to get public safety responders there, and then they can ambush them. Those are specifically different situations, but the public needs to be aware, and your prosecutors need to be aware that those cases need to be publicly um, uh, addressed with prosecution of the people that would perpetrate something like that. So we have an unfortunate time when there's a lot of violence in society, and it has gone against fire and EMS personnel. It made our life a little more dangerous. It forces us to look at every situation and consider what would happen if violence began to occur, and then to plan for that. It is our opportunity always. We want to serve people in public safety. We love the public and we love taking care of people. But if it is violent against us, then that forces us to take those steps. Please take care of yourself and others around you. Help us help the public. It's Doc Talk. It's almost August. Enjoy the rest of your summer. School starts in many places in 2 weeks. You take care.